According to a recent article in The Hill, every year about 58,000 pregnant women enter prisons and jails, and 4% of them are entering prison, 3% are entering jail. That's all according to a study by the Pregnancy in Prison Statistics Project. Race and politics reporter Cheyenne Daniels took a deep dive into the Black maternal mortality crisis, and she does join us this afternoon. Cheyenne, it's good to have you. Okay, and hopefully we have some audio here and hopefully you can hear me, but you're examining the health care of incarcerated pregnant people and really the practice of shackling. So how are current practices impacting those who are pregnant and they're also behind bars?
Yes, thank you so much for having me. As you mentioned, the practice, particularly of shackling, has become a major concern for advocates, both who are incarcerated and those who are not, because of the practices that we see, which include not only shackling, but also solitary confinement, not much access to prenatal care, and even not necessarily great diet offerings for those who are incarcerated. The outcomes are rather severe, which include miscarriage, preterm birth, and potentially even stillbirth and the life of the mother being at risk.
And then are there current systems in place to really improve maternal health behind bars?
So there are some attempts to improve maternal health behind bars. One of them is that we are hearing advocates really pushing for an end to shackling. That is one of the biggest issues that we have here. And as you mentioned, we do discuss this in the podcast a little bit. It's just because of how dangerous it can be, particularly if there's an instance where the mother needs to catch herself because she trips and she is unable to because she is shackled. So really that is a major component right now, is to end the shackling, but also to provide better care, for instance, just keeping women out of solitary confinement if they are pregnant.
And then lastly, you highlighted a bill in Tennessee that went into effect back in 2022. In part, it prohibits placing a pregnant inmate in restraints, and there are some obviously exceptions there. Is there additional legislation or any other proposed solutions to help in that effort?
Yes, absolutely. Advocates are calling for the passage of something called the Dignity for Incarcerated Women. And what that would do is, in addition to ending shackling, in addition to ending solitary confinement, is it would really address what it is that pregnant incarcerated women need in order to have a safe pregnancy, in order to be able to carry their pregnancy to term. On top of that, we're also hearing women calling for there to be a separate way to incarcerate pregnant people until after they give birth, up to a full year after they give birth, so that not only can they be pregnant outside of a facility, but also so that they have time to bond with their baby after that child is born before they enter the carceral system. So there are definitely moments that we are seeing take place across the country to try and address the crisis. And so far, 22 states have passed the Dignity for Incarcerated Women Act, but there is definitely still a push to have this become a nationwide agenda.
Okay, Cheyenne Daniels from The Hill, thank you so much for joining me this afternoon.
Thank you.
Coming up right now, for more